the Mentor Podcast with Dr. Karen Tyndall and Dr. Laura Schwint.
Are you a high achiever feeling the burnout blues? The Mentor Podcast is your oasis. Before we introduce you to today's phenomenal guest, we're going to extend an invitation to something extraordinary. We're mixing up the perfect antidote to burnout with our Mint Julep newsletter, a weekly dose of inspiration delivered straight to your inbox.
That's right. Each edition of the Mint Julep is more than just words on a page. It delivers connection, brimming with inspiration, positivity, and a dash of fun. Think of it as your virtual happy hour with a supportive community of high achievers. We'll help you unwind, recharge, and rediscover the joy in every day.
So subscribe to the Mint Julep and let's clink glasses or coffee mugs to live a more inspired, joyful life 1 week at a time. Maybe you're more of a visual learner. Well, we've also got you covered. All of our podcasts plus bite-sized coaching tips are on our YouTube channel, which is youtube.com/@themintdoor. It's there that you can subscribe for happiness on the go.
So welcome back, health enthusiasts. Get ready to dive deep into the fascinating world of oral health and its profound impact on your overall well-being. Today, we have the incredible privilege of hosting a true champion of holistic dental hygiene, a passionate educator, and a clinical expert with over 3 decades of experience.
So let's give a warm welcome to the one and only Kristin Evans, the BS and RDH. Kristin is known by many as the PH RDH, and she is a powerhouse in the dental world. She's not just about clean teeth and healthy gums. She is on a mission to revolutionize how we view oral care. From her roots at Idaho State University to becoming a national speaker, she's a force to be reckoned with. Kristin, we're thrilled to have you and welcome to the Mentor Podcast.
Well, listeners, welcome to today's Behind the Mask Mentor Podcast. And we are super excited to bring to you Kristin Evans. Kristin, thank you so much for being with us today.
Oh, thank you so much for having me. I am thrilled to be here. I love you both.
We love you. So listeners, you're in for a treat today because Kristin is a wealth of knowledge and a genuine soul. So yeah. So we're going to get right into our first question, though, which is, what insecurities have you hidden behind your professional mask?
Well, I thought about this question, and I feel like I'm a pretty open book. I think we all have insecurities. I don't know if anybody likes to really share a ton of them, but I think they do help us. But I think one of the insecurities I have, I don't know if necessarily I hide behind it professionally, but it definitely is an insecurity, is that I feel like I need more letters behind my name. And I think that comes from possibility of feeling the rank of dental hygienist compared to dentist, compared to masters in hygiene or education. Something, all the letters and letters and letters that people get to give credibility to their speaking. And so that's been something that's been in my heart a lot as I'm talking to other professional speakers and educators, and they're like, yeah, you should go back to school and do education. And I just keep feeling that it's not for me because of the time that it takes to stop the progression of what I'm doing and then take a time off really in order to get letters behind my name. And in this day and age where we have amazing abilities to be able to really be fed information, to be able to dive into massive research through the internet, I find myself, I want to be the expert in bone, systemic and oral bone support, longevity, aging, especially in supporting women. And I study daily the experts and look at things and research and new stuff. And I was doing some this morning even. So I'm constantly doing that. And I feel like I'm just on this long journey of my own kind of schooling without having to have the letters. And I think I need to be able to say, it's okay. Like, it's okay to do that. And to convince others that that's the truth, is that I'm the expert and I want to be the expert in that. And I take it really seriously. So I don't know. I think, again, I think we all have insecurities, but I think sometimes those insecurities can certainly weigh us down and actually take us off our journey and I'm a big God person. So it's like, I rely on that, his guidance in my journey. And I think that there's those pitfalls or stumbling blocks along the way. And I think sometimes those insecurities are weighing us down and telling us, like, you can't be what you want to be. So.
There's so much to unpack there. But one question I have is, as you describe your journey of continual learning, why can't you just give yourself some letters?
Yeah.
Right?
Hey, I mean, I already on the bottom of my thing, my daughter goes, that is way too long, Mom, because I say the PhRDH, speaker writer. I'm like, I just want people to know about me, like to give them so maybe I need to be, for sure, myself. I need to say, it doesn't matter. Mm-hmm. And maybe I do need to give myself, maybe I need to make up some letters.
I think MCL, Masters of Continuing Learning.
MCL. We maybe need to do something like that. Masters of Continual Learning. Okay. We're going to work on that, girls.
Mm-hmm. I mean, if I think about, like what you say about like going back to school and how that stops the progress in what you're doing right now, which is impacting so many people. I
don't want to stop. I think if I did stop, I may never get going again.
Right. And who's to say that a certain curriculum would have everything that you're already doing right now?
Yeah, that's the truth of it. So I love you. I love that. I'm taking that. I'm going to put that, actually, I think I am. And I'm going to make people ask me what that is. So today is a new day for my continual letters.
There you go. You got it. I anoint you with that.
I will grab it and take it.
I think the proof that you deserve those letters lies in the fact that as you were talking, I forgot I was doing a podcast. And you were talking, and then it led what you were saying led me off down multiple different rabbit holes, just pondering the points you were raising and how does it hold us back. And so that is success for me. I forgot I was here, and I was just about to start like just sharing about my insecurities. Like, it's not about me, it's about Kristin.
No. But I would love to hear that. We can do that whenever.
We can do that. We can do that another time. Yeah. Because I am not the star today. But as you come to terms with maybe that it's not the actual letters that give you that credibility, how does that then change who you feel that you are without needing letters?
Yeah, I think mostly what we just talked about makes me just feel like hopeful. I'm a big peace person. And if I don't have peace in something, then it tends to be like just not chaos, but you know what I mean? That kind of inner chaos of like unsurety, maybe unsurety. So right now, I think what we've just talked about makes me take that insecurity and bundle it up and just say, I'm throwing you out the door, because now I'm taking on MCL. Like, I'm going to take on the new me, which is empowering. So I think it's empowering to me right now. Like, this was healing. I didn't realize that we were going to do this, and I am stoked.
I love conversations where they just organically happen and all like different pieces are tied together in little bows, that's one of those pieces in the MCL. But what it makes me think of, Laura, is you sent me that synopsis. What Eckhart Tolle book was it?
Oh, The Power of Now.
That was
Oh,
it.
The Power of Now.
That makes me think about, because I read that in bed this morning and I was thinking, oh, it'd be a quick read. And I was still there and I was like, I have to get out of bed.
Get away.
But it brings me back to that, is being happy and satisfied with the present rather than worrying about all those letters.
Yes, I love that. And I need that because sometimes I'm a futuristic, I'm always looking at the future and not sitting in the now. And so I love that. Thank you. I'm getting healed today.
Hopefully this resonates too with anyone that's listening, because, you know, a lot of our audience are high achievers who have climbed many mountains and accomplished many things. And, you know, you can get into that trap very easily of anchoring your happiness to that next goal.
Yes. Yeah, totally is. Or looking at not having enough and then thinking that that is a negative thing, like enough for me, enough speaking opportunities or enough ways to, I'm sitting in my own self and want to share so much and maybe not be able to. But then you look back and I see so many blessings that come because I didn't do something or I had time, something ends up popping up where it was like, for me, it's like God had a plan. God knew where I needed to be. He knew who I needed to touch. And so in that situation, I really rely a lot on that, but I have to stop myself from thinking like, why don't I have more? Or why can't I do more? Or because it's always wanting that more instead of, again, sitting in the now and being like, what have I been so blessed with now? And when you look back on it, you're like, I've been blessed with a lot. So I love that.
Yeah. Aw, this is awesome. I just feel all warm and fuzzy.
Me too.
Well, you know, speaking of warm and fuzzy, our mouths sometimes get warm and fuzzy. And that leads me to our next question. You are a huge advocate of oral systemic health. And I would love to know, what is one thing that you wish everyone knew about the oral systemic connection? And why does that passion of yours drive you so well?
So I think the one thing, and when I speak, this is one of the very first things I talk about, and then it continues, is that oral systemic is super individual. We cannot take everything that we have and try to put everyone in this little box and say, oh, because you have this, you're going to have this. We have to, I really believe that when you're discussing oral systemic and you're pondering it and you're diving into it with a patient and really being the detective, I always talk about, like, as dental professionals, being the detective for the individual is, what is it? What is driving this disease? What is happening with this patient? What are the underlying conditions? What are the screening that I need to be doing that I'm not, or even therapies that we need to be doing? Because it's about the individual. And we are all made up of so many different cells. There isn't one unique person, not even an identical twin. And so we have to know that because we're all individuals, like, we have to have individualized care. And it's super important that we do that because it also makes the relationship better with our patients as they see that we care for their not only oral health, but systemic health. And it drives down to the fact that we care about them individually. I don't say this to everyone. I'm individually customizing this appointment with you today. And I think that's important.
Can I be your patient?
Yeah, I've worked in my office for 31 years, and I've cut back, and now my patients are all freaking out on me. But I love them so much that I don't want to quit clinical. And so I continue to stay in my clinical realm as a hygienist because I love my patients. I love them, and I love making a difference in their life. And that's really where that oral systemic comes in, because it's not about scraping teeth. It is not just about removing calculus. It is about healing, helping. I mean, sometimes it's even, I mean, we all know, I think in dentistry, that sometimes we become like the psychologist as they're sitting there and they start to go through like things in their family life, because you have that connection because you're with them longer, especially a dental hygienist. And it's private and intimate in a sense, because you're usually, it's just the two of you. I mean, there's other people sometimes in the room when there's a parent, but a lot of times it's just between the two of you, where as you guys are dentists, you have usually an assistant. There's more people. So some people are reluctant to open up with things, but it's a beautiful thing. And I love my job. I love my job.
You get the opportunity, like when you describe that, it's like one-on-one relationship that you get with a patient and how much they can share. That I'm sure that they share lots of things that probably even surprise you with what they're telling you, even if it's not related to dentistry, or they don't think it's related.
Oh yeah. I mean, sometimes it's hard when you're on a schedule and you have the person that sits down and tells you that their child is, struggling and is possibly suicidal. And, what are you to do? Oh, sorry, like I'm on a schedule. I need to take these x-rays and things like that. I mean, when they sit down and they're like, I'm having a really hard time, my child is struggling, then sometimes I have a very caring employer that has been like, sometimes it just doesn't work. Sometimes you just don't do anything but love people. And I've had that opportunity to sometimes just not even do anything but sit and cry and pray with people. And so I feel blessed because that's not everybody's employer. But I would tell people to try to find somebody that's like that, because it doesn't happen all the time. But what are you supposed to do when someone does that? When someone comes in with that really hard thing and they're emotional, like, okay, well, I need to go through your medical history. I need to take some x-rays, where I'm on a time crunch. I got another person in the waiting room. Like you just can't do that. It's a hard area, but oh well.
Well,
It sounds like you go, Laura.
You might not get those x-rays, you might not get that health history, but you did heal by being that person that received and was open to just listening and being there for that person. And I think that that's a big piece of what we do. I mean, most of us, I would say, went into the healing profession because we care about people.
Absolutely. I totally believe that, because that's why I did, is I love people and I love connecting. I love that relationship. So yeah. And I was going to say, really, those are the people that are going to spread the word until they're going to tell other people, that they had a great experience, that they love the office. And, that's part of it too, is that, you're establishing a relationship. And that person also will be the person that when you tell them that they really do need dental work, they're the ones that don't balk at all. They're not going to be like, I don't trust you. They're like, you have me. You are part of me. You have my back. You've been there for me. So yeah, I think it's just about relationship building and loving people. So
love never fails.
Love never fails. It does not.
It doesn't.
And connecting, finding the relations, finding the common ground with people, no matter where, is love.
Yeah. I mean, you're so easy to talk to, and how you put everything. I mean, I would, like Laura said, I would want you as my hygienist, like, easily. But we know you've been very open with your experience also of talking about osteoporosis and menopause. And we were wondering if you'd be able to take this opportunity to share with us a little bit more about your journey and maybe what you've learned that we could maybe use like you do day to day in a clinic to the benefit of others, to the benefit of our listeners who are hearing this.
Yeah. So, crazy is my journey with kind of autoimmune disease happened when I was 30. That was 24 years ago when I was pre-diagnosed with MS. And I started just really trying to figure out, like, what does this mean for me? What is all of this about? And I was, 30 years old, very young, and just trying to say, like, what is the future of my life? And then realizing as I started going through things that I was really responsible for my own health journey, that even finding second opinions and really diving in and finding out, is this true? Is this something? So we'll put the MS on the back burner because it never happened, thank goodness. But I am so grateful that I had that because it put me on this health journey as I started to see more and more, and actually very careful with like what is happening in my body, because I didn't know if it was going to happen, because they always told me there's a possibility you're going to just wake up one day and have full-blown MS. And I was like, oh, okay. And so it was kind of like this whole thing of watching and waiting. So went along with my life, and in 2017 got on a really big health journey for inflammation and changing my life and wanting to really heal myself, and felt like I was doing really good. And then we got to, got to be 50 and then 54. And last year I was 54 and I had some really big health things happening. I actually, in all honesty, I haven't ever told anybody this, but I thought I had cancer. I really thought something was going to pop up because I was not able to gain weight. I was fragile. I was getting sick a lot. Like I'd go see my grandchildren and I'd get sick. And I was like, I know because I study this, something's wrong with me. And my blood work was, really good. I had my brother, who's a primary care physician, pull me aside at a family thing and said, I want you to get an osteoporosis test. I want you to get a DEXA scan. And I was like, what? No way. Like, I don't have osteoporosis. I'm 54. Like, I don't even know that much about osteoporosis. And so I was like, he's my baby brother. So I had to prove him wrong. So I only did the DEXA scan to tell him, like, I'm going to preview that I am not. And sure enough, crazy. At 54 years old, I was diagnosed with severe osteoporosis and had no clue. No clue. You could have blindsided me with anything. I would not have picked that as it. And didn't really take it super serious at first because I was like, I don't even know about it. And as I started diving, it's really, I believe it was my God journey. Like, he's putting me on this path because I'm going to change the world. I'm going to change the world for early screening for osteoporosis, so that we can have a marker, bone marker for patients way earlier than what's normal right now is 64 years old or even later. I have patients that have never had a DEXA scan, and they're currently like 62 years old. And so I'm like, we need to get this out there, and we can do it in dentistry. We can do things. I've got a lot of things I'm working through. But this is something we can do, especially because we are great screeners, and we can find it in signs of it in the oral cavity. So let me tell you a little bit about risk factors. Well, let me first tell you about osteoporosis because I think it's important. So it is a progressive metabolic bone disease. Progressive meaning it does progress if you don't change things, but it is treatable. So I want you to know that. It's not like a death sentence, but it could be. And so it does cause low bone density. So the bones become more brittle, and the risk of fracture and fragility is high when you have low bone mass. Obviously, it's been looked at for centuries as an aging, an old woman's disease, but that is not the case. This disease is even coming into 20-year-olds. They're starting to find it in so many different people, and we're starting to find it in men, which is totally rare, which they don't really think that that was a cause. I mean, that was something that was going to happen, but our men, now it's 20 to 25% of men have osteoporosis. They're not lifting weights as much, and they're lower in testosterone. This is a big hormone disease. It does have factors in that. One of the big factors is early menopause, low estrogen in women, and low testosterone in men. Risk factors are also white, small, so Caucasian or Asian, small framed. I have little teeny tiny little finger bones. I'm a petite person. I always have been. There's risk factors in cigarette, alcohol, and caffeine. We also have risk factors in, obviously, toxicities. I've been diving into that, heavy metal detox, heavy metals, maybe even mercury. There's chances because it sits in our bones. These heavy metals can sit in our bones for 30 years. In dentistry, we're around a lot of that when we're taking out amalgam fillings throughout our life. We've had that in dentistry. I'm an older hygienist who had mercury, played around with mercury in our hygiene clinic. Didn't take it that serious, but there's a lot of toxins that are in our air and our water. Obstructive sleep apnea. There are so many really cool things that dive into this. IBS, eating disorders, inactivity. We have mineral deficiency, steroid use, people that are using PPIs, so people that are on protein pump inhibitors, people who are on Ozempic or any of the GLP-1s. Those are causing muscles to atrophy, and then muscles and bone go together. So these are all things that we can look at with our patients. I can now pick people out on the street and say, she's got osteoporosis. And why is that? Because 1 in 2 women over 50 right now will fracture. 1 in 2. We don't have any other disease that's 1 in 2. We have 1 in 3 women that will have osteoporosis. And we have 20 to 25% of men. This is also a disease that is not always being evaluated or screened for. Right now, they say 20% of women will have 3 fractures before they're diagnosed.
Jeez.
3 fractures before they're even diagnosed with it. So we have a lot of room to grow. And we have right now, they're saying that every 2 minutes a bone will break due to osteoporosis. And so this is something we're not talking about. And we can see risk factors. We can take it. Again, my whole thing is, why are we doing this? Why are we letting people go to a point? Because it is it's called the silent killer of women. It's a silent disease, similar to periodontal disease. In fact, it mimics a lot of the same things, but we don't know until it's almost too late. And so the silent killer is the fact that I didn't even know. I had back pain, and I thought it was hygiene. And I had receding gums. I have 4 molars in class 1 furcation, and I'm a dental hygienist with no bleeding or probing. Was that not a sign? But I had no idea because we don't teach it. So I'm here to change it. I'm here to change because I want to save women and men. Because if I would have had a bone screening, a DEXA scan or a REM scan, which is an ultrasound of my bones, if I would have had that at 30 to 40 years old, that's when we have our highest bone density peak. Why are we not taking a baseline at that? Why do we not have a baseline? And then we monitor people and we say, aha, we see that you're falling quicker than normal. And is there something we should be doing? Is there some way of screening? And I'm working on that through CBCT scan. So anyone out there, Cone Beam is going to be awesome with AI. And I'm hoping to work with great companies to do that. But it is something that blew my mind. This was a year ago. I have been lifting weights. I'm on hormone replacement. I am packing protein. Protein is huge. And I'm not saying plant-based people can't get enough protein, but I was struggling being more plant-based, and I've had to really I mean, I'm a sardines girl. Like, I eat sardines and they're amazing. My gut actually sometimes craves them now, but so anyway, I'm super passionate about this. We could talk for hours about this, but do you guys have any questions?
I think my first reflection is just, I think, thank you for kind of getting this out. This wasn't something that I was aware of. I mean, I've heard of osteoporosis, but I've never considered or heard about what a problem, like an endemic problem, this is within the population. I've never imagined it affected men and had no idea that young people could be affected by it either. And it just really gets you thinking that it's added another thing on my list of, I'm thinking about so many things of how to maintain and, prolong my health for as long as you possibly can. But this is now another one that I need to bring it to the forefront to be more intentional about, okay, what am I doing for this piece of the puzzle?
Yeah, I don't think people understand what bones do. I mean, your bones store all your minerals. Like, you die if you don't have good mineral storage. You cannot replenish the valuable minerals that are needed for your body, and your bones are constantly. Every 10 to 12 years, we remake our whole entire body, our structure. Like, it's crazy to think about. But if we don't have those minerals there from our foods or the ability of our bones to actually take it and utilize it, then we won't, and we'll become very fragile. We know that if you have, right now, I think the stat, let me see if I can find the stat again, 40%, almost 40% of hip fractures will die within the following year. 40%. If you have a hip fracture, there's 40% that you will die in the next year. So this is something to actually take. It's not looked at as I should say it's getting more traction. So, but we don't have osteoporosis specialists. That's the problem right now that we have with osteoporosis, is that we have so many different people that are just surface. So there isn't a specialist right now. Like, I follow Dr. Doug Lucas. He's Optimum Bone Health. He probably right now is the leading expert. He's an orthopedic surgeon. He is the leading expert for me for osteoporosis right now. And he dives into deep studies. He's willing to look. He's willing to change and adapt. And so he's one of them I really, really follow for osteoporosis. But the problem is, you're either going to see an orthopedic surgeon, because my brother he's an orthopedic spine surgeon. I have another brother that's that. And you're going to see them because you broke. But they don't do prevention. They're fixers. So that that's not really where their specialty is. They just tell you, like, oh yeah, you have it. So most people are being treated by their primary care physician, who my other brother is. And I will tell you, I love him dearly, but he gets most of his information from Big Pharma. Because why? Because he doesn't have time to be the specialist in everything. He cannot be the expert in all the areas of people that come in. And so he learns from Big Pharma, like, okay, well, we're going to put people on Prolia or some sort of bisphosphonate. And we do know, I'm not a big fan of those, especially if you're young. But you need to have that conversation. There's other options that could be better because they have a short lifespan. You can only take them so long. So if you're 54 and you can only take them for 2 years, you're kind of screwed after. Like, what do you do? There's a lot of new things coming out too, and there's probably going to be tons of great stuff, we hope, because it's affecting the Asian. Japan is right on this because their communities are really struggling with it. And then, of course, in the United States right now, we have a lot. So you're either going to be primary care, you're going to be your orthopedic because you broke, or you're going to be from a rheumatologist or an endocrinologist because you're struggling with autoimmune or thyroid. Thyroid's a big one that plays a part in osteoporosis too. So, autoimmune, anything that's inflammatory, because it's an inflammatory bone disease. So anyway, and by the way, anybody that has family history, you're definitely at risk. So if you had a mama or a grandma or a sister that has it, and I have a daughter that I worry so much about because she also has had issues with her menstrual cycle, PCOS. I mean, those are just combinations that are at a young age could absolutely be not having to meet her peak bone by the time she's 30. She'll be a lower even on that, and then progressively could have issues. So again, I'm really big into educating early. I want to screen early. I want the protocol to be that we screen for everyone when they're 30 to 40 to get your baseline. We do it for mammograms. Like,
right.
Why can't we do it for bone density?
Right. This is such an important topic. And thank you for sharing your journey, because I think that, I think it's really important to share our journeys, because that makes it personal. And it's obviously something that you're super passionate about. And I can't think of anyone better than you to get this word out.
Thank you.
And
I guess because I got it, right? I believe sometimes when we're given, I believe for sure when we're given trials, they are for ourselves, but they're for others. And I will tell everyone right now, this was not where I was going to be. I am a grandmother of 4, and I had always thought my life would be, I was going to retire from hygiene at 30, and I was going to be with my grandkids and read books. I was going to sit on my couch and read books and sub when I wanted to. And God had another plan for me. And this osteoporosis came when I had a voice, when I had a platform. And now I'm like, this is what I'm supposed to do. So this is not my journey. This is a higher person's journey. And I'm willing to do whatever he needs so that I can not have someone be 54 years old and diagnosed with something that we could have easily prevented or helped. When I was in my 40s, when I started to first find the signs that I was going into perimenopause, when I should have been tested for my bone density, and I would have been given, eating instructions, lifting. You guys, you have to lift weights. Sorry. Like, you will not become Arnold Schwarzenegger, but you need to lift weights for longevity. And I'm talking men too. Like, men, you get out there. And I'm not talking cardio. My daughter loves to run, but if you listen to Dr. Doug Lucas, he will tell you cardio can wipe you out if you're doing too much cardio, because you end up becoming too lean. And we need muscle mass. So you have to do 3 times a week. You got to be lifting weights. And I do. I lift. And I love Fitness with PJ. She's on YouTube and she's free.
Awesome.
She's Canadian. Laura, right? Are you Canadian?
I'm not Canadian.
Okay. I thought you were Canadian. Okay. Well, I know that Karen is not. She's
not Canadian.
Okay. Sorry. Laura's not Canadian. I thought you were.
But I like Canada.
I love Canada too.
Oh, well, this has been super insightful. And I know one of your biggest passions is speaking about this.
Yeah.
And so what formats, how do you like to speak? How do people, if they're like thinking this would be something for my group or my organization, what ways do you speak and how can they reach you?
Yeah, so I'm available. Just reach out to me. I try to make whatever I can work. I speak at any event, anybody that wants to have me. That's where we met. But I was talking on pH, which I still love, and it still comes into play because that was where my start was in pH, and I still love pH because it's a driver of disease in the mouth. And so I really, I love to speak at events. I will speak on podcasts. my thing is I just want to get the word out, is that we need to keep our eyes open. We need to keep watching for people, and we need to be talking to our patients, especially, this is key, men or women that come into your practice that have no bleeding on probing. They are your A+, spot on, do everything you want, great oral hygiene, and they keep losing bone. There's a reason for that. And so I've just through the years gone, what could it be? What is this? And now all my patients that I've been able to connect back with since my diagnosis, I've been able to say, I need you to go get a DEXA scan. They've personally texted me, I have osteoporosis. And I'm like, I knew it because I see the signs. So I want you to keep that in mind. I've had people come back and say they're normal. And I'm like, great. So maybe there's something else. But I'm just saying it's something to get to their physician for. And it's hard though. Some insurances don't always pay, but that's where I'm trying to work on if we can get things done with CBCT without as much radiation and stuff like that. So we're working on it.
That's awesome. Well, you have your email, Kristin Evans, RDH at gmail.com, right?
Yes. And I'm on LinkedIn. I'm also on Instagram, which I'm not the best at social media. So, well, the good part is I won't be sending lots of things to you if you follow me, but I would love you to follow me because that also helps. I don't know if everybody knows, but when you are a speaker, many of the events actually look at that. And if you don't have very many followers, they don't usually pick you. So, and if you have any connections with anyone, please reach out to them and say that you would love to have me talk, because I am a talker and I love to educate and I love people.
Yeah. Well, and you're so good at it.
Oh, thank you. Thanks. I appreciate that.
Yeah. Well, thank you for this. This is eye-opening and thought-provoking, and my brain is just full of curiosity right now. And so I hope our listeners feel the same and got some value out of this. And follow Kristin, reach out to Kristin.
Anybody, I love to talk to people. So please, message me with questions or with concerns, or I love to learn. So I want to hear your experiences. I want to hear all that because it helps me to be able to spread information to other people, is when I hear other things and then I connect. I call myself a little bit of the cruise director because I love to take information and I love to tell people a little bit about it, and then I send them off to go have the experience or to go learn from somebody. And so I love to dive in and find the connection. And then I tell people hey, I've connected this, go deeper. And so I that's what I really love to do. And when I speak like that, and I give people these tidbits, and I'm like, you find what's best for you and go out and find your journey. Mm-hmm. Find where you can improve someone, where you can become that individual healthcare provider for that one person. And that's all that matters if you help one person.
Well, that's a good mic drop spot to stop, I think. Awesome. Thank you so much, Kristin.
Well, thank you. It was fun.
Yeah. And listeners, know that we adore you. We hope you found some encouragement from our podcast today. And we'll see you on the next episode of the Mint Door Podcast. Bye.
Thanks.
Thanks for listening, and subscribe for more holistic performance content.